5 of the House of Commons Standing Committee on Health. Today we meet to commence our study of Bill C-284, an act to establish a national strategy for eye care. We will then proceed to sit in camera to resume consideration of the draft report on children's health. Today's meeting is taking place in a hybrid format pursuant to the House Order of June 23rd, 2022. In accordance with our routine motion, I'm informing the committee that all remote participants, namely Ms. Ashton, have completed the required connection tests in advance of the meeting. Before we begin our consideration of Bill C-284, I'd like to welcome the Honourable Judy Scrow, the member for Humber River Black Creek and sponsor of the bill. Resounding applause. I would also like to welcome Emanuela Lamoureux, appearing from Health Canada to answer any questions about the bill. In accordance with our previous discussion, colleagues, we're going to go right to clause by clause. Ms. Scrow will be available to answer any questions you have, perhaps with respect to individual clauses. And we also have counsel here, legislative counsel here, for any technical questions. So, with that, pursuant to Standing Order 75 sub 1, consideration of Clause 1, the short title, and of the preamble are postponed, and therefore the Chair calls Clause 2. Ms. Sidhu.
Thank you, Mr. Chair. I would like to move Lib 1, which adds vision rehabilitation to the strategy and was suggested in MP Sugro's consultation with the vision community to make the bill as comprehensive as possible and cover all possible aspects to vision healthcare. So I will read into the record, except I'm removing clinical practice guidelines, which I'm now starting reading. By replacing line 5 on page 2 with the following: the prevention and treatment of eye disease as well as vision rehabilitation to ensure. B, by replacing line 12 on page 2 with the following: disease and to vision rehabilitation. So over here, I'm removing a comma, including clinical practice guidelines. It's removed. And C, by replacing line 14 on page 2 with the following: eye disease prevention and treatment and on vision rehabilitation. D, by replacing line 17 on page 2 with the following: shin to eye disease prevention and treatment and to vision rehabilitation. And E, by replacing line 24 on page 2 with the following: to the prevention and treatment of eye disease and to vision rehabilitation, including. Thank you, Mr. Chair.
Thank you, Ms. Sidhu. The amendment is in order. You will notice that when she moved the amendment, it wasn't exactly as per the amendment that was circulated, so I would invite legislative counsel to comment on that and anything arising out of that.
Thank you, Mr. Chair. Thank you, Ms. Sidhu. Just confirming that in the English, by replacing line 12 on page 2 with the following: disease and to vision rehabilitation, semicolon. That's where we stop. And if I could confirm the following for the French, because there's a slight change in the line numbers. Par substitution, à la ligne 13.
By replacing line 12 on page 2 with the following, and for the amendment: disease and to vision rehabilitation, and then we remove all that's following and a semicolon at the end.
Yes.
Thank you, Mr.
Okay.
Chair.
Thank you. Dr. Kitchen.
Yeah.
Clarification, can you repeat that again? This is changing to what we were sent, correct?
Yes. Yep. So what has been changed is at paragraph B, the words including clinical practice guidelines and the comma immediately preceding that are not part of the amendment. So that's the import of the change.
And just a semicolon at the end.
Correct.
Okay, thank you.
Is there any debate with respect to Lib 1, Mr. Abultayev?
Well, thank you, Chair. And I'm surprised. I know that the word with eye rehabilitation has been added almost to every line under Section 2, but including clinical practice guidelines, that's going to be removed completely based on the suggestion or the amendment that from Ms. Sidhu. I'm wondering why this is just coming now, last minute, while we have the sponsor of the bill here. If Ms. Sidhu or someone can really explain that to me.
Thank you, Mr. Chair. Through you, because I think it comes under provincial jurisdictions to respecting the jurisdictions. So that is why we are removing that. Thank you. And any other extra, I'm happy to return to Ms. Agro if you want to add on something.
Do you have anything that you want to say about Dr. Kitchen's comments? Or Mr.
Just
Abultayev's
on the
comments, sorry.
You know, on a PMB, you have to be extremely careful of the language that you use in order to make sure that we are respecting jurisdictions and so on. And that was the reason for having to delete the including clinical practice guidelines. The vision rehabilitation is a specific request from the Canadian Council for the Blind, CNIB, because the future is a lot about rehabilitation, research, and change. And they all of the clauses have been put together with CNIB and all of the various vision loss organizations on the bill. So anything that's here as far as amendments and the bill itself has been worked out with those various organizations. As you know, I've been waiting since 2003 for the government at the federal level to start focusing on vision care.
Okay, so we have a speakers list, Mr. Thériault, and then Dr. Kitchen, and then Mr. General. Mr. Thériault, s'il vous plaît.
Simplement pour dire.
Mr. Chair, I just wanted to say, to respond to Mr. Abultayev, visual rehabilitation was added here, but then we're putting the semicolon at the end because it was Amendment G2, so I can see that we're going to use this when adopting Lib 1. So this was already planned. We were already aware of this amendment in G2. Yes, exactly. You are correct.
Mr. General.
Mr. Chair, and thank you to Ms. Grove for the bill. It's the unfortunate part is that with all these amendments that have all of a sudden been thrown at it, it's changed, and now where the bill seems to have was initially acceptable, we're now debating amendments that have changed the intent of what the bill was, unfortunately. But I do understand some of it, and my colleague, Mr. Abultayev, brought up the issue on including the clinical practice guidelines, and I agree with Ms. Sidhu because it was going to be a point that I was going to bring up, is that is an issue that is really deals with the regulatory bodies making that decision. It shouldn't be bureaucrats making a decision on what the clinical practice guidelines should be. So I'm glad to see that that part is being taken out. One of my question is on the issue of adding the vision rehabilitation, and I understand that in the sense, and I recognize the great value that the CNIB does in what they do in providing that vision rehabilitation to so many people with vision issues and vision challenges. Ultimately, my concern, though, is where the legislation is, or where it's being put forward, it sort of indicates that the government is going to determine who those people are going to make the decision, who's trained to make the best choice for those vision rehabilitation. In the sense that, you know, is it the ophthalmologist, is it the optometrist? Those are the people that are qualified. It's the professions that determine that. And so the reality is, who is going to make that decision as to the vision rehabilitation specialists that are going to put that forward? What skills do they have? And ultimately, that should be the profession that's making that decision, not, again, bureaucrats and government agencies to do that. So it is a concern I have on adding that too, and I'm wondering if you could comment or whether someone could add to that. I would appreciate hearing from that, please.
By having it as part of initially I had moved forward without the rehabilitation in, and it was introduced to me by a variety of the organizations who said how important it was to be moving this bill that they've waited so long for, to also talk about the future. And the future has a lot to do with rehabilitation for vision as well, and asked that it be included. I don't think it's the government that would dictate, but it needs to be part of the structure of the framework, because what this will do going forward with your support is create a framework. And within that framework, of course, it will move forward within the government and together, and it talks continually about working with the provinces, the stakeholders, and the various partners to move forward with the framework. So ultimately, I believe the appropriateness would be done.
Mr. Genero?
Thank you, Mr. Chair, and thank you and congratulations to my floor mate for making it this far with your PMB. Mr. Kitchen had a lot of my questions just about the vision rehabilitation, and you and I spoke a little bit before committee about that. I was hoping maybe just for the comfort of some members, providing, I get it's in the future and kind of we're planning for that, but maybe if there's some examples of what exactly that scope would mean, I think it would again. It seems like something that is forward thinking and progressive as part of this bill. But again, if there's something that could provide us with that, I guess that maybe a bit more tangible about vision rehabilitation, what it looks like and what it would mean, would be great.
Just, I don't have a lot of examples, but I can say that there recently was apparatus, I will call it, that is new research that's been done for macular degeneration. And it was recently approved by Health Canada. And again, that is going to change the way macular degeneration is dealt with in Canada. But more importantly, it is going to ensure that more people are going and getting tests done early, are becoming aware of eye disease. If 1 in 5 Canadians have eye disease, that possibly could be prevented. We need to talk about it, and we need to be doing whatever we can to on the prevention side, right? And on the rehab side, helping people regain their sight or maintain their sight makes them be able to enjoy life, period. Because otherwise, it just, as you all know, and we've all talked with many of you, once a person loses their eyesight or is severely diminished, it changes everything. They're subject to depression, isolation, so many things that make it very difficult for them. So anything that we can do that moves a framework a little bit farther ahead that will encompass the assistance for them, I think is invaluable.
Mr. Abultayev?
It's on the same issue. I'm sure Judy is a very experienced member of Parliament, been here for a long time, and I'm surprised to see these come in last minute. I thought we saw the first reading of the bill and the first version of it, and I was completely okay with it. And I know that time is an essence to make sure that they'll move forward. But I'm not quite comfortable with these changes, to be honest with you, unless better explanation is in place, and especially it's coming last minute where we thought today that we're going to move forward on the bill.
Dr. Kitchen?
Mr. Chair, and just I had a chance to further to my earlier question, and ultimately, I think when you look at, excuse me, 2A, where it says identify the training, education, and guidance, by using that word, it implies that the government and bureaucrats will determine what that training and education will be. And I guess my concern is there a better way to change that word such that it doesn't imply or could be construed to say that you are dictating to the professions what they need to do for their training, what they need to do for their education, to ensure that the professionals are appropriately trained and able to do the job. And whether that is with the, and that is also from the vision rehabilitation specialists as well, because that's now added to that sentence.
Well, by adding the, if I can, Mr. Chair, adding vision rehabilitation in the various lines, that's the only change that we're referring to. And I think you would find that highlighting different things like vision rehabilitation is just another positive way of trying to move forward with ideas and thoughts. The last thing the government does, I would suggest, is decide and dictate training or any of those. It's not within their ability, and I don't think that it really is calling on them to be responsible for that.
Go ahead, Dr. Kitchen.
With all due respect, I would disagree with that. Having been a regulator and having been involved with the labour mobility within Canada, that is exactly what the government was trying to do to the professions, was to tell them how to educate and how to train their professions. And so I do have an issue in the sense that I want to make certain that we protect all professionals and vision specialists on this avenue. And I want to make certain that we aren't putting in more legislation that would turn around and the government then says to the president, well, here it is, it's in law, now you have to do it. And that is a concern for those professionals.
Do you want to respond to that, Ms. Scarrow? If not, we'll just go to the next speaker.
Oh, I mean, I don't think the government is going to be dictating as to how the professionals need to be doing their job, whether we're talking about, and especially talking about something like vision care or anything else. I don't think that's the intent here at all.
Ms. Lamoureux, do you want to weigh in on this?
I have nothing to add aside from the fact that the strategy itself, of course, will be presented at a later stage and would be, as per the draft bill, the subject of consultation with stakeholders.
Thank you. Mr. Perkins, please.
I thank you, Mr. Chair, and thank you, MP Scarrow. As a person who's been dealing with a detached retina since last fall, I appreciate all that I'm still having trouble dealing with, and looking forward to the end of session so I can see my surgeon in July. Going through all of that process and understanding now, both in Halifax and here, the care has been very good. So excuse me if I've gone over some ground that you may have already covered, but I'm just trying to understand the dividing line here between federal and provincial roles in the professional association in this. So I think the bill is obviously well-intentioned. It's just that I'm a little concerned that it's a bit of intrusion perhaps into what the provinces do, and with MP Kitchen's comment on like 2, B, C, and D, they're fine with me, but I think I'm struggling with the word identify the training, which it sounds to me like there is some sort of national training standards that's being empowered to the government to do, which I don't think is a role, and it doesn't sound like that's your intent.
If I can add, it's certainly not my intent. This is meant to establish a framework to begin consultations about vision care in Canada and what we can be doing to improve vision, what we can do on the preventative side together with the provinces and our stakeholders. So it's the establishment of a framework that would begin the discussions. The removal of including clinical practice guidelines was specific for the issue of being sensitive to the issues of the provinces. The provinces has their jurisdiction, we have ours, but by the federal government showing leadership in the issue of vision care, it will bring the parties together to to design and move forward of how do we get more attention onto vision loss in Canada? If 1 in 5 have an eye disease, how do we make sure that people are aware of that? It's awareness, it's leadership at the federal level.
I agree, because my detached retina, I had no signs of it. It was just through my annual eye checkup that they discovered it and said, you've got to get right in for surgery. I didn't have the usual symptoms of white lights and all of that stuff that you get with detached retinas. So if I hadn't had the regular eye clinic, it would have been a challenge. So I agree with the idea that we need to have more advocacy for people to take advantage of this, of the benefits they already have through most provincial healthcare systems, to at least go in and do those checkups so that they get all the attendant things. There are lots of other health things unrelated to eyes that you can tell from the eyes. So, but it's just, and maybe it's just I'm struggling with the word identify. It sounds like a standard. I don't know if there's a less, there's another word that is more, guidance as opposed to identify. To me, and I'm not a lawyer, so I understand the struggle of dealing with some of this.
Well, especially when you're doing a PMB, you have to be very careful and structured with your language in order for things to qualify and move forward. And I thank you for sharing that issue of your retina as well, because part of this is education and awareness. And if we come together and we're talking about it, there will be a variety of people who will go and get eye exams that haven't had one for a very long time. And it's awareness and prevention and moving forward to establish a framework. That's what I'm asking in Bill 284.
Thank you. Mr. Joe Harry, please.
Thank you, Mr. Chair. I'll withdraw my request. I was going to ask Madame Lamoureux if she
Joe
wanted
Harry,
to
sorry
chime on
to
that.
interrupt you. The bells are ringing, so we require unanimous consent to continue while the bells are ringing. Can we have consent to go for another 15 minutes? That allows people time to get back to the house if they need be. No? There is no consent. The meeting is suspended. Thank you, everyone. We will resume where we left off, and just to remind you where we left off, we were debating Amendment Lib 1. Mr. Joe Harry had the floor, and next on the speakers list are Mr. Theriault and Dr. Hanley. Back to Mr. Joe Harry.
Thank you, Mr. Chair. I was just going to ask Madam Lamoureux if she had any comments, but you beat me to it, and she responded to that, so I'd withdraw. I'll give you the time back.
Monsieur Theriault, s'il vous plaît.
To them?
Yeah.
Okay, right.
Monsieur Theriault, vous avez la parole.
Mr. Theriault, the floor is yours. Thank you, Mr. Chair. So during our break for the vote, I was trying to deal with the issue that we are facing. It's true that when I read this in French, it corresponds with Ms. Sugro's intentions. When I read it in English, there's a problem that the Conservatives have raised. So I'm trying to get an English translation, and so that's why it's been hard work. I'm not a translation expert, but I'm trying to find an English translation that will better reflect the French text, because I'll try to be brief, but I want to tell people you're aware now of my concerns regarding jurisdiction. We have spoken at length about this at our last meeting, so it's important to me. So I did hand out a text. I think Mr. Kitchens received it. But I'm going to read it. I have two modifications, two amendments. So, just a second, Mr. Theriault.
Allez-y.
Go ahead. So I'll start with the most simple. Firstly, I would like to modify the French version. So I will present my amendment that in the French version, page 2, line 10, we changed the term determined by identified. In French, determined is much more structural than to identify, and in English, we're using the word identify. Because when we look at B, C, D, we use the same terms for each paragraph in French and in English. Do you have it in front of you? Yes, but what I've been told is that this is not a sub-amendment to the amendment that we are currently speaking of, that being Lib 1. But it would be more appropriate to bring this up later on in our process. After G1, it would be more appropriate to suggest this. And then we can debate upon it. Okay, then we will move forward with the main amendment in that case.
Je vais donner la parole brièvement.
I'm briefly going to give the floor to our legislative clerk, because she's speaking to me at the same time that you have the floor, so I think it would rather be easier if she spoke directly to the committee. Thank you, Mr. Chair. Mr. Theriault, if possible, could you send us the written version of that which you just suggested? And the chair already said it. the lines that you are speaking of will be discussed after G1. I was told that this had been sent to the clerk. Everything has been written out as we speak. Okay, thank you. So we will come back to that. Do you have anything else? Can I read the amendment? Or would you prefer that we pass out the text?
On va terminer le débat.
Okay, we will finish debate. And then we will vote on Amendment Lib 1.
Vous pouvez présenter votre amendement après.
And then you can present your amendment after G1. Okay? Just a second. So, are we not on G1, or rather we're on Lib 1? We are still on Lib 1. And then following that will be G1. So Lib 1 was adopted as is, and then there will be an amendment? Okay, because it's coming slightly complex. I just want to clarify. Perfect.
Dr. Hanley and then Dr. Pelosi.
My point is somewhat moot now, but it relates more to the wording. So it's probably more appropriate to wait until after Lib 1.
As you wish. Dr. Pelosi.
So as this is public and as this will be answered, and when people go back and look at it, this is on the record. I want to just clarify something. It's come up a couple of times that in treatment guidelines, these are the jurisdiction of the province, whereas almost all treatment guidelines are national to my knowledge, like the Canadian Cardiovascular Society, the Canadian Diabetic Association. I think more the concern, though, is that with this legislation, it would be the government requiring there to be guidelines. And I think probably the government shouldn't be in the business of requiring the medical profession to set guidelines in certain areas. So I think that would be the reason why we've removed the setting guidelines from the actual legislation. Thanks.
Is there any further discussion with respect to Liberal 1? Before I put the question, I need to inform you that if Liberal 1 is adopted, G2 cannot be moved due to a line conflict. In essence, the last-minute change to Lib 1 effectively incorporated G2, so it would, but it would not be in order if Lib 1 passes. Are we ready for the question? Yes. All those, shall Lib 1 carry? Yes. Hands, okay, I see consensus. Thank you. That brings us to G1. Mr. Vancouverton.
Thank you. Pardon me. Thank you very much, Mr. Chair. I'm just calling up my spreadsheet here. G1 is for clause number 2, and it replaces line 8 on page 2 with the following. From, the national strategy must describe the various forms of eye disease and include measures to. 2, the national strategy must describe the various forms of eye disease and may include measures to, Does everybody have a copy of that?
It is as was circulated, just for clarity of committee members. So the debate, the amendment is in order. Any discussion with respect to Amendment G1? Shall G1 carry?
Yes.
Carried. That then brings us to the amendment that was raised by Mr. Thériault. Donc, Mr. Thériault, maintenant.
So, Mr. Thériault, now is the appropriate time to share your comments with us on line 10, I believe. Yes. Would you like to have the paper version? Or can we move ahead? Just verbally. It sounds like the clerk is able to send this out right now. Okay, then we will wait.
Je l'ai sûrement reçu.
Colleagues, the legislative clerk has asked for a couple of minutes to have a look and consider this. I'm going to suspend for 5 minutes to allow for that to happen. The meeting is suspended. Well, Mr. Terrio and the legislative clerks had a discussion around the amendment that's about to be presented. I'm hopeful that that will expedite the discussion so that we won't have to get mired in the technicalities that they did during the suspension. Donc, à vous la parole, Monsieur.
So, Mr. Theriault, the floor is yours. Yes, so, Mr. Chair, I will be reading the amendment now. And there are some modifications compared to what you received, but nothing significant. Some spelling things as well, and looking to respect what has already been adopted. So this is how the amendment reads. That in the English version, on page 2, line 9, 10, 11, we change the entire subsection. I will not read it. I don't think it's necessary. And we will replace it by the following.
Un apostrophe à S.
An apostrophe after S. Identify the professional's needs for training and guidance of the prevention and treatment of eye diseases. We're removing disease because we already adopted liberal one.
Professional needs for training and guidance on the prevention and treatment of eye. On arrête là.
And we stop there. And then the sentence will continue on with what we had already amended.
L'amendement est en bonne forme, donc.
The amendment is in order. So we will now hold debate on the amendment.
Any, Dr. Kitchen?
So just for clarification in the translation, my understanding would be that content 2A on line 9 would now be identify the professional's needs for training and guidance on the prevention and treatment of eye diseases as well as vision rehabilitation. Is that correct?
Thank you, Mr. Chair. Thank you, Dr. Kitchen. Just for clarification, it's not precisely correct, but I'll reread it. Monsieur Theriault is changing lines 9, 10, and 11 only on page 2 to read the following. A, identify the professional's needs for training and guidance on the prevention and treatment of eye. That's Mr. Theriault's change. But since Lib 1 was adopted, it would read in its entirety. Identify the professional's needs and training and guidance on the prevention and treatment of eye disease and to vision rehabilitation. That's it. Oh, sorry. Hold on a second. Sorry, Mr. Chair. Just give me one moment. Okay. Thank you. I'll repeat that one more time. A, identify the professional's needs for training and guidance on the prevention and treatment of eye disease and to vision rehabilitation.
Anything arising from that? Okay, Dr. Ellis? No. Dr. Hanley?
First of all, it's the first time I've heard Monsieur Theriault speak English in this committee, so I wanted to congratulate.
It's a start, a slippery slope.
But speaking of English, I understand the intent, I have some concerns about the phrasing because we've now deviated from kind of standard English phrasing. So either we can accept the spirit and then work on the English, or I would suggest on the fly that we try to fix the English, because it sounds like translated French. With all respect, it's not the way that the English phrasing would read.
Clause by clause proceedings on a piece of legislation are not the same as drafting a report. We have to settle on the wording, and it isn't an option to clarify it outside the room without suspending and coming back. Mr. Thériault, et puis Mr. Van Coverden.
Monsieur le Président.
Well, Mr. Chair, I tried to translate it as best as we could. There was a distortion between the English and French version. If the English version was written in French, I was voting against. So I think it's quite important. So I didn't understand why the Conservatives were speaking of interference or potential, etc. And so I looked at the English text and I thought, okay, I'm happy with the French text, but the English text goes much too far. And that's why I think the French and English texts, as they are worded, represent this intention. Because our colleague, Ms. Segros, recently said that what the Conservatives suggested was not aligning with the intentions. So if we have more adequate terms, well, essentially, I feel that the way it's written is not too bad, as is.
Je veux juste ajouter,
And I just wanted to add, when we look at B, we have promote research. In C, we have promote information. D, we have ensure that
Juste à A.
Ensure that Health Canada. So the distortion is only in A.
Guidance, c'est très différent.
Identify the training and guidance is very different than determine healthcare professionals' needs. Essentially, these are two very different things. We're talking about determining needs for training. So that's why we made this amendment, and then I will have another amendment in French to change the term déterminer to identifier.
Mr. Van Coverden?
Thanks, Mr. Chair. Just to say that I think it's important that we stick to standard legislative language, and the clerks are the experts on that. And I don't want to get too lost in our interpretation of the various semantic differences between things and how to translate. I'm certainly glad that I'm not the person in charge of translating any documents or legislation. It's not an easy thing, so I just wanted to say that I think we should leave that and that work in the capable hands of our legislative clerks. Thanks.
Any further discussion on the amendment proposed by Mr. Thériault? Dr. Hanley.
Juste pour être clair, est-ce que c'est le mot for?
So just to be clear, is it the word formation in French, training, that you'd like to remove?
Si je peux demander.
If you don't mind my asking. It's formation, training? No, it's not just the word training, but it includes this word, yes.
Just identify the needs of professionals for training and guidance on the prevention and treatment of eye diseases and whatever that was rehabilitation needs after that.
You could suggest it, but if you want it to be a sub-amendment, you'll need to provide it to us in writing and have our legislative clerks opine on it.
Mr. Chair, may
Yes,
I?
please.
Identify the needs for professionals. I would say, I believe there was a practitioner also in there previously for professionals and healthcare, the needs of healthcare professionals. Identify the needs of healthcare professionals for training and guidance on the prevention and the rest of the phrase. Would be a suggested sub-amendment.
You can do a friendly amendment. We're quite happy with that.
Can it translate?
You don't have to change the translation.
All right, so
Mais ça sera pas plus vite, là.
But I don't think it'll make it any faster.
okay, if we have unanimous consent to dispense with the need to provide the amendment in writing, then we can go ahead with that. Do we have unanimous consent to adopt the wording as a sub-amendment as proposed by Dr. Hanley? Okay. All right, so we've dispensed with the need to provide it in writing. Can you reread the proposed sub-amendment, Dr. Hanley?
Avec plaisir.
Yes, my pleasure.
Needs of healthcare professionals for training and guidance on the prevention and treatment of, and I'm sorry, I don't have the phrasing in front of me, but whatever the phrasing was, eye diseases and rehab needs or something like that. Right.
Please.
Thank you, Mr. Chair. If I may repeat it for clarification and to ensure that it's correct. A, identify the needs of healthcare professionals for training and guidance on the prevention and treatment of eye. And that's the sub-amendment to the amendment of Mr. Thériault.
Sub-amendment is in order. The debate is on the sub-amendment. Shall the sub-amendment carry? Yes. Carried unanimously. The question is now on the amendment of Mr. Thériault as sub-amended. Any further debate? Shall the amendment as sub-amended carry? Carried. Brings us to G2. G2 was
Because of Lib 1,
cannot be
G2
moved.
is.
That brings us to G3. Dr. Ellis.
Chair, the conservative side is willing to accept the rest of the amendments on division.
All right. Can we move? They do have to be moved. Can someone move G3?
You're so kind.
We accept Matt Jennery's offer to join the Liberal team, and I'll move G3. I always thought you were a good progressive. G3 and the other amendments as well. Thank you.
G3 moved by Mr. Jenneru. Is there any debate on G3? Shall G3 carry? Carried on division. That's it for Clause 2 then, I believe, unless there are any further amendments for Clause 2. So the question is, shall Clause 2 carry? Carried on division. Sorry, Clause 2 as amended.
Yes.
Carried on division?
Yes.
Carried on division. Brings us to Clause 3. There is one amendment on
Monsieur,
notice for Clause 3. It's government, it's G4.
Monsieur
Anyone care to
Président?
move?
Mr. Chair? Did you forget my second amendment?
No, we did not. We said as amended, so we are fine.
Quand je voulais changer le mot,
The part where I wanted to change the word déterminer to identifier.
OK. Je suis informé que ça s'était inclus.
I've been told that that was included in the amendment. And it's adopted.
Brings us to Clause 3. Do we have someone to move G4? Mr. Van Couverden?
I move G4.
Okay, any debate on Government Amendment G4 as circulated? Shall G4 carry? Carried on division. Shall Clause 3 as amended carry? Carried on division. Shall Clause 4 carry? Carried on division. Shall Clause 5 carry? Carried on division. Shall the short title carry? Carried on division. Shall the preamble carry? Carried on division. Shall the title carry? Carried on division. Shall the bill as amended carry?
Yes.
Carried on division. Shall the chair report the bill as amended to the House?
Yes.
Carried. Shall...
Thank you all so much. Thank you, Dee.
Shall the committee order a reprint of the bill as amended for the use of the House at report stage?
Yes.
Carried. I guess that's it? All right. So, colleagues, we have resources until 1:30, but our next item of business is in camera, so we would need to suspend in order to go in camera. So perhaps we can bid adieu to the sponsor of the bill and then determine what you wish to do next. Ms. Sgro, I would describe your efforts in advancing this bill as being a prime example of someone who is perfectly impatient. And like Mr. Perkins, I am in that the 1 in 5 Canadians with eye disease, having had LASIK surgery in my 30s, a spontaneous detachment of the retina in my 40s, cataract surgery on both eyes, a trabeculectomy, an iridotomy, and I take 3 drops a day for my glaucoma. So I'm pleased on a couple of levels to see what has happened here. Congratulations to you. Okay. Yeah, I have 20/20 corrected vision, but if the glaucoma flares up, that could change real quick. It's being well managed by some excellent professionals, I can assure you. Thank you, Ms. Lamoureux. Thank you, Ms. Sgro. Thank you to our legislative clerks. Probably a bit more than what you might have expected, but thanks again. All right. Unless directed otherwise, I propose to suspend in order to go in camera. Dr. Ellis.
I move to adjourn, Chair.
Is it the will of the committee to adjourn the meeting? I see heads nodding. Ms. Ashton, how do you feel about that? Yeah.
My apologies. Yep, I support that. I agree to the original timeline, and yeah, don't have much more time to give on my end.
Okay, I see some heads nodding and some not over on the Liberal side. Do we need to vote on this? Okay.
You see part of the reason.
All right. All right, the meeting's adjourned.